Hello, hi, my name is Samuel Izurza for the SE channel. Thanks for tuning in, subscribe, and share as much as you can. Okay, please take your vitamin C, vitamin D, vitamin and your zinc tablets. C and D are very important, good for the immune system, and take vitamin D. Also very important. Um, and your zinc tablets, very important. I also take tonic water. It's got a little bit of quinine in there. You never know. Any little bit helps. Just drink, just to upgrade that immune system, if you know what I'm talking about. Every little bit helps. Okay, and I do wear a mask everywhere I go, inside, especially like the Costco's of the world and the WalMarts when I need to buy some stuff or I haven't gone to the gym yet. I haven't really gone to places where like the restaurants, like bars or something. I haven't really gone there yet. I don't feel comfortable yet, especially with my age group. But the virus is real, okay, and just be careful. That's all. Wash your hands. Be careful, and that's all. And we'll get through all this, okay. Uh, Taiwan TD upgrades response. This was the first time that I actually knew about the coronavirus. Actually, it wasn't January 15th. I think it was late January that I knew about it. We saw videos of China, people in China, dying and, whatever. It's all that propaganda by the Chinese government, which they actually, cordoned off. I think it was like three-quarters of the population. So it was strictly probably around the Wuhan area. Like I said, um, they're talking about Beijing, people in Beijing and areas around that never even got it. So um, this was the first one that you know, I actually read. And if you're telling me that Taiwan CDC does not talk to the Spanish CDC or the UK CDC or Italian CDC or even the US CDC, something's really wrong here because they knew about it. Taiwan kind of knew about it. Wasn't 100%. They were talking about here, in China, just called Cheng Cheng. Yeah, okay, this is the lunar year and so on. People, billions of people, about a billion people, like going back and forth to visit their families. It's a huge holiday in Asia, and while the official mantra remains no clear evidence of human-to-human transmission, it is still very clear in early days in the outbreak that there's obvious gaps in our knowledge and understanding of this virus. So they didn't really have that much proof January 15th, but they were warning that something's really bad here. They haven't seen it, and which is why, despite the lack of clear evidence, human transmission, public health, like WHO, CDC, Hong Kong, treating this outbreak as a credible threat. See, this was the first time I was reading this. I said, "What is that? What is this?" And then we start watching videos, and I said, "Okay, well, something's really happening here." And you're telling me that the NIH or the CDC or they didn't really know about this. I'm sure they did know about it. They just didn't do anything. So when I was reading this, I said I was looking for this link, by the way. I said I gotta find that link. It says today's Taiwan CD has posted two updates. First upgrade is today: severe special infectious pneumonia to a class 5 legal infectious disease. So when they saw this virus or in Taiwan, they actually upgraded it to a class 5, whatever that is, legal infectious disease, probably the highest. The Department of Disease Control has listed severe special infectious pneumonia as a class 5 legal infectious disease since January 15th, 2020. And I was reading this at the end of January. So if I knew at the end of January that something was going on, the CDC specifically, I'm sure the CDC in the US knew about this, or kind of knew, or was warned at that time. Okay, because remember, the flights from Wuhan was still happening. Thousands of people every day were coming to the US, to Europe still, at that time. Um, by the way, this is in Taiwanese, but in English. It's translated in the Department of Disease Control has officially listed severe special infectious pneumonia as a fifth category of statutory infectious disease since today in order to strengthen the surveillance and prevention of severe special infectious. Um, I mean, you guys can read it. CDC reminds that this is okay. So they knew something was happening. Okay. The CDC is now in the season of respiratory disease such as influenza and pneumonia, and urge those who plan to visit the local area and nearby areas to avoid entering and exiting traditional public markets, hospitals, and other public places, and contact with wild and livestock animal. Implement personal protective measures such as washing hands and with soap and a mask. If fever or flu-like symptoms occur within 14 days of returning to China, you should proactively notify the air traffic control and quarantine staff. Wear mask as required. So basically, they knew about they kind of knew about this disease, or this virus. This is highly infectious virus that had the delivery system of the HIV system and SARS in it too. So they haven't really seen this virus, and they were warning the CDC. Taiwan. This is Taiwan. Okay, I had to find this because I knew this was like the first one, and I got to thank this guy because this blog. I mean, if it wasn't for this guy's blog, I would never even known about this for a while. The second longer statement was published today, indicating that until proven otherwise, Taiwan CDC will prepare as if the novel coronavirus is transmissible from human to human. They weren't sure, but the Department of Disease Control has not ruled out the possibility of human to human transmission of a new coronavirus, and that relevant control measures have been deployed based on the situation that was the virus. Maybe transmitted from human to human and have been completed. We're looking at the 15th of January here. Okay, so you're telling me that the Dr. Fauci's of the world and CDC did not know about this at least early February minimum, because I knew about this at the end of January. I remember, because I started doing my first videos on the coronavirus, the Wuhan virus, the Chinese virus. I think at that time I called it the Wuhan virus and then the Chinese virus. The WHO says that the new type of coronavirus may have limited human-to-human transmission in 2019. Taiwan had a feeling. The Office of Disease Control and Administration has stated that the possibility of human to human transmission has not been ruled out for the virus. Now, this is the CDC in Taiwan, not in the US, and that the human to human transmission may be considered for related control measures. So, people with respiratory system are reminded surgical masks should be worn, and the public is urged to avoid crowded and poorly ventilated places at that time. See, at that time, they were warning people if you have an existing disease, or be careful if you go to hospitals or any public places. Urged to wear a mask. Remember, in Taiwan, it's kind of normal to wear masks. Not in North America or in Europe. This is relatively new to everybody. It is recommended to wear a mask when going in and out of the places. Okay. At present, a response team has been organized to develop guidelines for surveillance, quarantine, inspection, epidemic investigation, medical infection control. Remember, this is all in Taiwanese. Okay, this is like the Taiwanese journal or a Taiwanese newspaper. So this was translated. Experts meeting, county and city health bureau meeting, an unwarned random inspection of hospital infection control have been held. As a result, these preventive measures are developed under the condition that the virus may be transmitted from person to person, and continue to collect information about the disease and virus. Consult the expert. Okay, so basically, they had a feeling. Okay, they had a feeling that it could be human to human. Okay, remember when I was reading this at that time, I had no clue. I really didn't really understand it. I mean, now in hindsight, yes, but I didn't really understand. I said, okay, well, look, something's really going on here. Yeah, could this be a human to human? The WHO at that time was, they were talking about non-human to human, and the CDC and the Dr. Fauci's of the world and all that. They were saying, no, don't worry, it's not a problem, not yet. Yeah, right. The CDC have been notified. The CDC has been notified by the Chinese Center of Disease Control and Prevention as of January 15, 2020. 41 cases of pneumonia caused by new coronavirus infection have been remained including six severe and so on. Among the confirmed cases, a few patients denied that they have visited the South China seafood market and only have been exposed to similar cases. So people were dropping in China, and or that could be in Taiwan, and said, no, I never been to this, to the Chinese seafood market, which is I was, well, when I were read, I think it's like what, was it 100 meters or a kilometer away from the Wuhan, what do you call it, the place where they do the coronavirus. Uh, um, okay, it doesn't come to my mind right now, but you know what I'm talking about. There was also a family gathering of a husband, blah blah blah, and infection. Okay, in addition to some environmental examinations, South China seafood market detected 2000 COVID. Lufeng also conducted preliminary investigation in other markets, and no clues are related to all this. Continues to strengthen surveillance. Anyways, um, you see, this is what I was trying to talk about. It's December 31st, boarding on the quarantine, the direct flights from Wuhan started, and 25 flights have been carried out with total 2,700 passengers and crew members so far. There are 9 cases to meet fever pneumonia cases. So, at that time, during, the lunar holiday and so on, a lot of families, they go, uh, especially in China, it's like Christmas, it's or some of the bigger holidays that they go see a lot of families. They travel, so it's pretty randomly transmitted from place to place. So CDA once again called for the approach of the spring festival travel season. If fever-like flu symptoms occur within 14 return to China, you should proactively inform the emission management, quarantine staff, wear mask, and so on. So see, they were um, they were scared. They knew. See, this is www.cdc.gov.tw, which I think is Taiwan. Um, and this was the first time that I actually knew. Now, if I knew the end of January that something was up, something was going on, I mean, I'm sure the CDC, with all their experience and God knows what is it, 50 years in the making, that they knew of experience, I'm sure they knew something was going on. They're not that stupid. Um, and obviously, what I think personally is that the Chinese government hid how severe this virus was, um, and that's it. That's all. I just wanted to tell you this is where I got my information at the end of January. And when you have Dr. Fauci and the CDC and all that, they're all like, okay, in March. Forget about February, March. I mean, it's a huge difference. That's 30 days, and thank God that it would have been worse if Donald Trump, the president, uh, still had the flights from China, and he was very quick. He was very quick to stop that. Um, anyways, just wanted to show you where how I knew, and I'm sure the CDC in the U.S. and Dr. Fauci had a feeling, and the WHO in China, probably did not give the proper information. That's why we have a worldwide pandemic. Anyways, the virus is real. Most of us will be like a very, very bad flu. Okay, but wear your mask and just take your vitamin C, vitamin D, and your zinc tablets. And the most important, just wash your hands and don't touch your face. That's what I do. Like I said, if you have a pre-existing disease, or if you have asthma, or if you have a heart disease or a lung disease, or it'll be worse. And yes, hydroxychloroquine does work. Two of my friends, they saved their lives with that. Like I said, I'm not a doctor, but most doctors that are treating patients with hydroxychloroquine, they see positive results. Now, what's going on? It's a conservative effort out there, concerted effort out there to diminish hydroxychloroquine, which costs what, $2, $3, $5, let's say, compared to the other drugs, that are anywhere from $2,000 to $3,000. a pill or a thing. But anyways, it's you can't even compare it. And hydroxychloroquine's been around. This malaria drug has been around for over 30 years. So I don't know what the big deal is. And obviously, this is, obviously it's a threat. So when you have the tech companies and you have the CDC and you have Dr. Fauci going against, obviously there's cash money to be made somewhere. Someone's going to make a lot of money, okay? Because $2-3 drug compared to a $2,000-3,000 drug, it's a huge difference. Anyways, take care. This was my first time I knew about this. I had to find this link, and if I knew about it, or if I kind of knew about this the end of January, I'm sure the U.S. CDC and NIH and the Dr. Fauci of the world, I'm sure they knew something was coming up here. Take care. God bless. All the best. And please share.